Hello and welcome to The Explainer. Today we're talking about something that hits close to home for pretty much all of us, healthcare. We're going to dig into how a really smart approach to automation can basically overhaul our clinics from the inside out, making them work so much better for patients and for the people caring for us.
So does this sound familiar? You're handed a clipboard with a stack of paperwork. You're waiting, and you just get that feeling that information is getting lost somewhere between you, the nurse, and the doctor. Well, you are not imagining it. Those frustrations we all feel, they're actually symptoms of a way bigger problem. And that bigger problem is that the system itself is under a ton of pressure. Our personal frustrations are really just the surface-level signs of a healthcare model that's stretched to its absolute breaking point, mostly because it's still running on old, manual processes.
I mean, think about it. The system is getting squeezed from every possible direction. Costs are just going through the roof, there are major staff shortages, and all of us as patients have higher expectations. But at the same time, so many clinics are just stuck in the past with paperwork and clunky workflows that slow everything down for everybody.
But this isn't just about inefficiency or being annoyed. It has a real, staggering human cost. This number, 17%, that's the share of preventable medical errors that could be avoided if we just had better automated support systems. This proves the problem isn't just about convenience. It is a critical life and death safety issue.
So, what's the answer? Well, it's not as simple as just plugging in some new tech. It's really about building a much smarter clinic system. Think of it like upgrading the entire operating system for how a clinic actually runs.
The core of this idea is what the source material here calls strategic automation. And believe me, the key word is strategic. This is not about getting rid of doctors and nurses and replacing them with robots. Not at all. It's a model for redesigning all the background work so that technology can support the incredible humans providing care, freeing them up to focus on what they do best, taking care of you.
You know, this perspective really frames where the whole industry is right now. As the source material puts it, automation is happening, period. This ship has sailed. The really crucial thing now is that we have to be smart and strategic about how we do it so we actually get the results we want.
Okay, this all sounds great in theory, but what does it really look like on the ground? What parts of your clinic visit are we actually talking about automating? Let's get specific.
Strategic automation really goes after the administrative, repetitive stuff that causes so much friction. We're talking about things like scheduling your appointments, the whole registration and insurance nightmare, billing, sending out reminders. By getting those things off people's plates, we're not touching a doctor's medical expertise. We're just clearing away the chaos around it.
Now, a change this big doesn't happen with the flip of a switch. The source material lays out a really clear four-step plan. You start by just mapping out and standardizing how you do things now. Then you automate the easy stuff first. After that, you connect all those automated pieces into one seamless system. And finally, you use data to keep making it better and better. It's a real roadmap, not a magic wand.
Let's use a perfect example. Patient check-in. The before world, we all know it. Manual data entry, paper forms, a good chance somebody's going to type something wrong, which leads to those long waits we all hate. The after world, you pre-register on your phone, your insurance gets verified instantly, and everything is way more accurate. The difference in the patient experience is just night and day.
So what happens when a clinic actually goes through this whole transformation? Well, the results are pretty amazing. They're measurable, and they help out everyone involved. This is the big payoff.
And yeah, the financial numbers are really powerful. The source shows that clinics doing this can cut their operational costs by up to 30%. But what's even more impressive is the annual return on investment. We're talking 25 to 50%. These are not little tweaks. This is a financial game changer for these organizations.
But the payoff isn't just about the money. Not even close. The real value is holistic, and it comes from 4 different places. Sure, there's financial and operational value, but just as important is the clinical value. You get better safety, better outcomes, and the huge value that comes from a much better, less stressful experience for the patient.
So all of this really points to the future of healthcare. Putting this technology in place isn't just a simple upgrade, it's a fundamental change in how we think about delivering care. And that means we have a responsibility to get it right. Which brings us to the most important question of all.
right? As we start using these incredibly powerful tools, how do we make absolutely certain that what we build is a system that feels more personal, more responsive, more human, not less?
And this, right here, is probably the most important takeaway from all of this. This one sentence sums up the entire philosophy perfectly. The goal is not to automate the human act of caring for another person. The goal is to automate the chaos, the paperwork, and the mess that gets in the way of that care.
This explainer was actually based on the strategic framework developed by El-Mustafa Bouatan. If you want to dive way deeper into this, I highly recommend checking out his book. It's called Healthcare AI Revolution, a practical guide for clinicians, executives, and patients. It's a fantastic practical guide for anyone interested in this topic, and it's available on Amazon now. Thanks so much for joining us.